It is frequently stated by medical authorities that a large proportion of illness today is caused by mental stress and emotional conflicts. And I have seen it estimated that approximately 60% of our hospital beds are occupied from sufferers with this type of illness. At the same time as illness of this type increases, we are faced with the prospect of a critical shortage of doctors for some years to come. Implicit in the two above statements is the distressing fact that during the next few years, an increasing number of sick people will, through lack of personnel, not receive the treatment they require. This unpleasant fact is unfortunately one of the many problems which must be faced in a rapidly developing society. There is talk at the present time of a possible collapse of the National Health Service, but whether this happens or not, the unalterable fact remains that for some years to come there will be a shortage of doctors and a steadily increasing number of sufferers from psychosomatic illness. And in considering this disturbing picture of the nation's health, it appears that a valuable means of aiding overworked doctors and of making therapy available to a large number of people has not yet been fully recognized. The views I am putting forward are the results of over 9 years of therapeutic work. It is my experience that groups of people can be instructed in hypnotherapeutic techniques and in this way learn to help themselves. If these methods were employed in the health services, particularly in the preventative health service, they would bring about a shortcut in psychotherapy comparable with some of the dramatic results achieved by antibiotics in the treatment of physical complaints. The following proposals do not suggest that laymen should diagnose or give medical treatment, but that working under the supervision of doctors, a register of approved hypnotherapists could give aid to many people who, because of lack of therapists, are unlikely to receive the psychological aid they require. It is not for a moment suggested that hypnosis is a panacea for all illnesses, but as many of today's ailments are caused by stress, worry, and nervous tension, if those people who are likely at a later date to suffer illness on this account, could it be instructed in relaxation and self-suggestion techniques before the illness developed? Much of today's psychosomatic ailments would be aborted or would never occur. An expanded preventive health service incorporating group therapy using relaxation and self-hypnotic and self-suggestion techniques could take much work off the shoulders of overworked doctors who could send patients to groups where they could be instructed in relaxation techniques and coached in positive self-suggestion. I know from personal experience that groups consisting of from 10 to 20 people can be instructed in these techniques, and I've conducted such groups in Australia, New Zealand, South Africa, Rhodesia, Kenya, and here in Britain for a number of years. My experience is that most people dealing with stress, nervous tension, and emotional problems require tuition in the personality skills of relaxation and self-suggestion rather than treatment. Despite all our scientific and technological advances, psychologically speaking, we are still in the dark ages. We get an instruction book with a motor car or a sewing machine, but with ourselves, the human machine, we get no such instructions. Every human being will inevitably faced with problems of adolescence, of marriage, of parenthood, of middle age, and of old age. If the individual is handicapped by some emotional trauma or other disability, these crises will exert greater strain. It is in the absence of such instruction that most psychosomatic illnesses develop, and yet they could be averted or absorbed by reassurance, relaxation instruction, and tuition in self-suggestion techniques. In most cases, a few hours instruction in relaxation, self-suggestion, or self-hypnosis would prevent many people suffering years of misery, ill health, and eventual breakdown, save doctors a great deal of time and the nation untold man-hours. Reverting to the practicality of such schemes, as far back as 1998, whilst on a lecture tour, I was invited by the New Zealand government radio services to broadcast a program to explain and coach listeners in some simple relaxation techniques, and also to carry out a mass hypnotic session over the radio, broadcasting suggestions of general relaxation and of general mental and physical welfare. This broadcast was well received, as will be seen from the letter from New Zealand Broadcasting Services. And it says, 20th of December 1998. Dear Mr. Rose, as you were unable to check the results of your broadcast from station 1ZB before departing from New Zealand, I thought you would be interested to know how the listeners reacted. The general tenor of comment in the mail received indicates that those who wrote enjoyed the relaxation brought about by your broadcast and thereby obtained beneficial results. As I indicated whilst you were here, I am sure that a series of treatments of this nature would bring about permanent relief to a lot of people. We have not had one word of criticism or any unfavorable reaction of any kind to your program, and I trust that when you return to New Zealand we will be able to broadcast a further series. Your best wishes, yours sincerely, signed J.W. Griffiths, Station Manager. I am not for a moment suggesting that anyone but doctors should supervise this therapeutic work, but it would be to the benefit of all if a register of experienced hypnotherapists was formed and they were recruited into some auxiliary medical register as a branch of the Preventative Health Service. I am sure that most hypnotherapists would, like myself, be willing to devote certain hours to such work on a voluntary basis in order to assist in the formation of such a scheme. The advantages of hypnotherapists being available at clinics where group therapy was being carried out would be that. Doctors could send along tense and worried patients or those suffering from psychosomatic complaints to be taught how to relax and to be initiated in the self-suggestion technique so that they could help themselves by positive suggestions instead of unconsciously bringing about a self-induced illness. People who are at present unable to receive psychological aid because of a shortage of therapists could receive reassurance through relaxation therapy pending psychiatric treatment. Further use could be made of such a register by hypnotherapists being attached to or visiting hospitals to give hypnotic treatment to specified patients to prevent them from worrying and to help them to relax and to cooperate in treatment. Hypnotic suggestions would have very great value in reassuring those who have operations pending and in helping in rehabilitation and in adjusting the mental attitudes of those who have to make terms with some permanent disability. Another very great service hypnosis could render would be to those who are fatally ill or are about to die. Hypnotic suggestions could make their last hours easier. Their minds and bodies could be eased and courage and comfort given, particularly by the therapists who themselves have strong beliefs in the meaning and purpose of life. At the present time, psychotherapy is the weak point in the nation's armory in the fight against ill health, for many illnesses are caused by mental and emotional stress. It is no dream to say that the hypnotherapeutic techniques, which in my view include relaxation, autosuggestion, self-hypnosis, and electro-hypnosis, could be a most powerful aid in strengthening this weak point in our medical services. This powerful aid is the healing force of nature herself. For just as broken bones will knit and torn flesh will heal, in the same way, given the right conditions, nature will also soothe the nervous system, restore emotional equilibrium, and bring peace of mind. Hypnosis is a natural healing agent which, correctly prescribed and administered, can, in a perfectly natural way, bring about a harmonious functioning of the mental, emotional, and physical functions. Sooner or later, hypnosis will undoubtedly take its place in the National Health Service, and the sooner this happens, the fewer will be the number of people who suffer emotional distress and physical illness.